Good afternoon, everyone. This is Melanie Karam over at Agent Link. Thank you so much for joining us today. We're going to let everybody kind of finish straggling in. We've got a pretty good attendance today, so we are going to get started right away and not make you guys wait. Thank you for being punctual. We are excited to get things going. I think this is our first webinar of the year, actually. We're kind of late this year, but I'll go ahead and start introductions while people start or finish getting logged in. We have Carl Bernhard here with us today with Allstate Health Solutions. For those of you that have been around a while, like me and Carl, Allstate has been through a couple name changes, but we've always had a fantastic relationship with them and love partnering with them. So we're happy to have Carl here to make sure we all know about all the different products that they offer and all the different ways they're there to support you guys as our brokers. So with that, Carl, whenever you would like to get started, take it away.
Good deal. Thank you so much, Melanie, for organizing this and having me present. Today we're going to focus mostly on the senior products, guys. So hopefully that was made clear and communicated to you. There's a handful of products in Kentucky. There's a handful of other products that we have across the country, a few that aren't in Kentucky yet that I'm still trying to fight with our legal teams and obviously the state approvals to get in. So we'll talk through what products are available as of today. While we wait for a few extra people to jump on though, as Melanie said, we used to be Assurant Health, if you remember us back then. We then were National General Insurance, and we've been Allstate for almost 5 years. Truly, the product offerings haven't shifted and changed that much. You guys have always done an amazing job on our under 65 plans. The short-term medical has obviously been a really hot product for us. But wanted to focus and make sure that you guys knew what was available in the senior space today. So before we get going in some of the content, I did want to make sure that you guys saw this. I know I've put this up in past presentations, whether it's via a webinar or in person in your office down there. But if you're going to sell with us, you might as well get some free stuff. So download that QR code. We have a program called Allstate Elevate Rewards. This gives you free points in an app, and you can use those points to buy a bunch of stuff. And truly, there's actually some nice stuff in here. It's not all Allstate pens and goofy insurance visors and stupid stuff that no one wants. There's actually some really good, valuable things in here. I know people in person last year, I think John had mentioned he got some Weber grill off of here, some other really, really nice items that do accumulate as you are going to sell with us. So if you haven't had it, I did want to make sure that you had that QR code. Obviously, this is on top of your commission. It doesn't take anything away. It just only adds to hopefully selling our plans versus maybe someone else that you're currently offering. This is me. If you haven't had a chance to meet me yet, hopefully I get a chance to meet and connect with you in person. But my name's Carl Bernhard. I'm the field VP in charge of all the agents that sell with us in 8 states now. And so many of you have probably connected with Sarah, who previously was more of an administrative role. I've promoted her into more of a sales role. So she's very, very dynamic and happy to announce her promotion to a lot of agents who have known and worked with Sarah for a long time. And we recently just brought Kathy on our team. All 3 of us guys have been in this industry for 20 plus years. All 3 of us were back working when we were Assurant. I started in 2006, and I think they both have started even before me. So that being said, I just wanted to make sure you had our phone numbers, our email addresses. The toll-free number there at the bottom connects to any and all of us. If you get nothing else from this presentation today, take away my phone number, take away my email address, and just know we want to work with you. We want to help you. Obviously, Agent Link and you guys have done such a good job for us for so many years. But if I haven't had a chance to really work and connect with you and you ever need a hand, reach out. Again, we're going to focus mostly on that senior market at the bottom here, but we like to say At Allstate Health, we're all things individual. We have solutions for all ages and solutions for all agents, kind of like a Swiss Army knife, right? And so we have a whole suite of under 65 plans that I briefly mentioned earlier, short-term medical. We have a really competitive fixed benefit plan, and then a whole suite of under 65 ancillary or supplemental plans, accident, dental, critical illness, cancer, heart, stroke, hospital expense protection, term life plans. And then we have a suite of senior market products, dental, vision, hearing. In many states, a senior accident plan. That's really the one that I'm trying to get into the Kentucky still. Same with a cancer plan. If there's a need for that, make sure you reach out and let me know. That'll only give me more ammunition to try to get approvals. But we do have a senior indemnity plan that's selling really, really well right now that we will cover. So these are the plans that I wanted to spend just a few minutes covering each of them. 2 dental plans and a senior indemnity plan, okay? A dental indemnity plan, more just cash that goes directly to your client, a traditional feel of a DVH product, and then that senior indemnity plan. So let's start with the first one, dental indemnity. I don't know if you guys offer much on the senior dental side as of now. But this is a market that's exploded for us lately. I think more and more agents, especially with the volatility in the senior market, are looking to add more lines of business with that client. Obviously, that keeps that client with you longer, increases your retention rate, keeps another agent from offering them something simple like a dental plan if they need it, and then not losing that Medicare sale as well. So our dental indemnity plan, fair to say most Medicare plans do lack a good comprehensive dental plan. Our plan helps clients pay for, the cleanings, the x-rays, the fillings, the extractions. Again, the cash is just paid directly to your client. And it's easy to bundle with a Med Advantage or even a Med Sup plan. And it's really simple. It's really clean. Clients can understand this policy. In my opinion, there's some dental plans in the market, and I'm sure you've seen them. They're confusing, and it's hard to really understand and break down what am I really going to get value out of. I would argue an indemnity style plan is almost the opposite of that. I know how much I'm getting back when I go to the dentist. Should I go or should I not go, right? So it's very, very simple. Our plans have no waiting periods for preventive and basic services. It's predictable. Like I said, the preventive services include the exams, the cleanings, the x-rays, and then we have kind of a good, better, best version where the annual max is $500, $1,000, or $1,500 on the indemnity plan. I thought this was an important slide to include. I did a presentation here locally. I'm based out of Wisconsin, and we have an agency here that sells a ton of this with us. I was with them last week, and they were sharing some of these statistics. And quite a bit more, but this policy does have an optional network through the Carrington Maximum Care Network. I was just poking around their site before I jumped on this call, and there's a good amount of dentists in your area that do participate with the Carrington Maximum Care Network. You're going to get an average of 45% off your bill, in addition to the reimbursements that your client's going to get if they can stay within the network. Now, the advantage with an indemnity plan is they don't have to stay in the network. They can really go anywhere they want. But if they can find someone within that network, it's only going to maximize the savings that they get. Okay, obviously, it's a simple add-on to any Medicare client you might have in place, and it creates some additional commission, some additional revenue per client that goes to you. So this is a screenshot taken right from the brochure of that good, better, best version of the plans. Basic, intermediate, and plus. You'll see the plus plan is, I would say 6 or 7 out of 10 sales I see coming in are that plus plan because you do get coverage for the major services. There's a 6-month wait for those services to kick in, but they do provide payments for all of the things listed there on top of your basic, and your normal $100 back for a visit for your annual x-rays and cleanings, things like that. Okay, these plans are also really affordable. So if they're going to be using it, and they're going to go see the dentist twice a year. And usually if they have like one more thing, it's more than paying for itself. Okay, I'm not going to read every benefit level to you. I just wanted to make you guys aware of what's out there and what's available to you. Okay, we do have a dental vision hearing plan as well. As of late, this one has sold even better than that traditional indemnity style plan. I think, you know, many carriers have a DVH type product out there. And so this one has, it's a no wait option with vision and, you know, discounts on hearing tests and devices and things like that available. So wanted to show this one to you as well. A few of the highlights, again, no waiting periods. There's benefits available from day one. Very competitive benefits. It was designed to either beat or meet all of the competitors in the space. It does have some increasing benefits. So if they keep the policy, the benefits increase year 2. The hope there, right, is with any dental carrier, the challenge with dental is, you know, people wait to get their crown filled and then they cancel the policy. And then, you know, carriers are left with, it's a challenge to try to figure out, how do I price this plan that's going to be good for your client, that the agent feels comfortable presenting and promoting, and also that the carrier doesn't lose money on, right? So it's got to be a kind of a win across the board. And so these increasing annual benefits have been something that we've been adding to even our under 65 dental portfolio that allows that to try to stay in place longer. This one taps into a different network. It's a little bigger network. It's the Aetna Dental Administrators Network. The link is right in the brochure. I'm happy to help look any dentists up if that would be helpful to you. So this is kind of the good, better, best version of our DVH plan. Level 3 is where you'll get the most benefits out of. I put that arrow down toward the implants section because I get a lot of questions when agents want to sell a senior dental plan. Hey, do you have anything that provides coverage for implants? The answer is yes. So you'll see the first year it's covered at 25%. The second year it's covered at 50% up to that annual max. And you'll see those plans, the annual maximum actually doubles once they've had it a year. So either from $750 to $1,500, $1,000 to $2,000, or $1,500 to $3,000. Okay, but there's coverage for dentures, your major services, right? Your root canals, your crowns, things like that. There's actually some value in this dental plan. And so if you haven't looked at it in a little bit, I'd encourage you take another look at it, because again, we've really tried to create a very solid product and price it very competitively in your area. Okay, little snippet on the network itself. It's got almost 90,000 providers. On average, you're getting about a 43–44% discount on your total bill. And it's a true PPO network with this DVH plan. That optional vision writer, the vision writer, let's go through some of the benefits of it. There's kind of a low version and a high version you can select. The high version obviously covers quite a bit more, and that's where you'll get more coverage for contact lenses, things like that. It's not just a discount, but it's actually provides some coverage for it. You'll see the copays there at the top. I'm not one to read every benefit level in a presentation. You guys are more than capable of doing that, especially an agency like yours. But the vision portion is through Avesis. Okay, so very strong vision side. Again, this one has about 80,000 access points. All the major retailers are in there. The Costco's, the Targets, the Sam's Club, the Walmarts. Those all participate in Avesis amongst quite a few others. I just listed a few of them there. On the hearing side, it's $75 hearing evaluation at one of 5,000 credentialed provider locations. On average, it's about a 64% savings for hearing aids. It includes all major brands and tech levels, which is really nice. It includes a year of follow-up care, 2 years of free batteries, and a 3-year warranty on those devices as well. The hearing taps into a big network as well. This is through Amplifon. So for a hearing network, this is actually a really strong hearing network. Okay, so again, high level, wanted to keep it pretty straightforward, pretty simple, what these plans offer. But the DVH plan, again, Aetna Dental Administrators, Amplifon, and Avisus Networks. There's hearing savings on all plan levels. We have 3 different plan options, some optional vision benefits. We have an increasing benefit to our product that tries to help your client see value in holding on to it. And there's the ages as well. I should have covered that at the beginning. But the nice thing about this plan is it's more flexible than some DVH products out there, in that the primary applicant just has to be 55, not 65 in order to qualify. So it starts at 55 and goes up to age 99. Finally, I wanted to talk through our senior indemnity plan. This is a plan that's relatively new. I'd say we've had it on the shelf for a year, maybe a little over a year. And it's really taken off, I would say, this past, obviously, open enrollment season. We saw a big uptick in our senior indemnity sales. A lot of agents found that our plan has some nice benefits compared to maybe who they were looking at previously. So obviously, senior indemnity helps cover those Medicare gaps. Provides cash benefits to help with your deductibles, your co-pays, your co-insurance, all of those things that Medicare might not cover. And the cash, I should say, is paid directly to your client. They can use the cash however they want it, right? So they can use their cash to continue to pay for their premiums, to pay for co-pays. They can use it to take a trip. Maybe they have some household expenses they got to keep going while someone's getting some care done. We like to say it's pretty affordable protection for someone on a fixed income. So obviously this is a popular plan for someone looking more on the Med Advantage side. So it's a lower cost alternative to some supplemental options, but it has some meaningful financial security. There's freedom to choose your provider, so there's no network restrictions to a plan like this. And it's simple, predictable, easy to understand benefits. So I'll show you the chart in just a second. But I get this question as I've been meeting agents more on the road, face to face, of like, why do I sell a plan like this? I already have their Medicare plan in place. Why would I sell a senior indemnity plan? Some of these stats might help you. So according to the CDC, 1 in 5 adults age 65 or older is hospitalized each year. So I like this isn't rare in retirement. It needs to be expected. It's 20% of people 65 plus, and obviously as you continue to age past that 65 number, those statistics only increase. Medicare does not eliminate your out-of-pocket costs. You guys know that, but data from the Centers for Medicare and Medicaid Services show that Medicare beneficiaries still spend thousands annually out of pocket. Many seniors live on a limited financial reserve. Maybe they're living off their Social Security. So this provides some predictable cash benefits that will provide some peace of mind to them. And I like this quote. It says, Medicare protects your health. A senior indemnity plan helps protect your retirement income. So some of the highlights of the plan: there's immediate benefits for sickness. There's a 90-day wait for your preventive care. It's pretty standard in the industry for that. The benefits for office visits, urgent care visits, and lab services. There's tier 1 and tier 2 surgical benefits. Provides coverage for up to 31 days of hospitalization per year. We do also have some guaranteed issue plans available. Some of those GI plans, if you want more about them, I didn't include any screenshots of that, but I do have some agents who really like that GI plan. That's right in the brochure, and I'm happy to get it to you if you need it. Who is a plan like this good for? The max plan that we'll show on the next screen It's a great option for seniors who maybe missed their initial enrollment window. Maybe they're waiting for their Medicare eligibility. Maybe they need to bridge the gap between early Medicare enrollment and their plan effective date. That base plan is a great option for seniors who are looking to supplement, obviously Medicare Advantage plans or their Medicare supplement plan. And our GI plan is a great option for seniors who just looking for a hospital admission payout and confinement benefits without having to provide any health history. So here's a chart of kind of the base plans are on the right. The max plans there are on the left. You'll see there's 5 plans total. Plan 3 has been a popular seller because you get a $5,000 hospital admission benefit. The other ones are a little bit lower, but plan 3 is what I see sold the most. And then it provides some tier 2 surgery benefit payouts as well. And this shows what it pays off for office visits, for your preventive care visits. Obviously, if they have to go to urgent care, it's going to provide payouts for them. Ground ambulance, air ambulance, emergency room coverage. So there's a whole list of things that the policy does provide payouts for. And it looks like I did sneak in some guaranteed issue options in this presentation. I think it was taken out for that agency that I did locally, but I popped it back in here for Kentucky. So guaranteed issue plans, obviously lower amounts based on no questions being asked, but it does provide some payouts for hospital admission and then a daily confinement benefit as well. This senior indemnity plan also comes with the Allstate identity protection. Won't read all the details of that, but it's complimentary. They don't pay anything extra for this, but I feel like someone in my family has their identity stolen from a credit card or something every year now. And for someone, you know, in that senior space, it's nice to have something that's going to give them some help fighting some of those challenges. If God forbid it happens to your client, just know that our plan comes with them. There's some credit monitoring, 24/7 alerts that they'll have access to. And so it provides up to $1 million in ID theft expense reimbursement as part of what they get with our plan. It also has it's called My Life Senior. So it's kind of the association that comes with the plan. It has some dental vision hearing benefits in here. It's got some diabetic service discounts as well. And then they get an optional membership into what's called Active and Fit Direct. So they can get discounts on fitness centers, on-demand workouts for free, things like that. This just comes with the senior indemnity plan as well. Okay. The other question that I get quite a bit is, hey, I've quoted with you on the under 65 side, Carl. And maybe I've written a short-term policy. Maybe I've written one of your hospital expense protection plans or one of your trio med plans in the under 65 space, but where do I go to sell and quote some of these senior plans? Same website that you go to sell any of our plans. So you go to that agent back office site, you'd log in, you put in your client zip code and date of birth, just like any other quote with us. And you'll see on the left, it kind of defaults to our under 65 plans now. Actually working to update that so it just automatically goes to a senior quote if you're quoting a senior. But you'll see the arrow at the top. I can just click on quote senior and it'll take you to a page that looks like this. So the senior plans will be listed on the left side. Dental shows on top. So you'll see that's a quote for a dental plan. The top one is the DVH product. The dental indemnity plan would be listed below there. If I click add, it starts a shopping cart on the right side of the page, and then I can just click enroll and you're off and running. So I just did a quick quote in your area, 40056 zip code, 65-year-old. The DVH level 3 is what, $55 a month. So pretty darn affordable, I think, for the benefits that you get out of that plan. The senior indemnity plan is that second tab there on the left. And then the accident tab, again, that's showing nothing in Kentucky, hoping to get those added here at some point. Okay, that's what I wanted to cover. I wanted to keep it short and sweet. In my opinion, webinars can get long and agents can get distracted because you guys are busy and you still have emails coming in and clients are still reaching out to you. And to be honest, I think my phone's rang 4 times since I started this one. So I didn't want to drag this on unnecessarily long, but I wanted to make sure you knew what we had in the senior space. So thank you for having me today. For many of you, your Medicare book is already built, right? Like you guys, there's so many agents that at Agent Link who have a massive Medicare book that's already been built. So I would argue now's the time to really maximize it. If you don't have plans like this with your clients, you really should consider offering some of them to them. The senior dental, the senior indemnity are 2 of the easiest ways to serve your clients better while adding some nice revenue to your business. And Allstate Health, like we said in the beginning, we've been a great partner with you guys for a long time. You do have a great contract here. Matt and the team have negotiated an incredible contract, meaning you're going to earn, a very competitive commission rate. And I'd love to help start offering these plans with you a bit more than what we've seen so far. So please reach out to me. Please reach out to my team anytime. We're here to support you. We're here to help you. And I appreciate your time.
Thank you so much, Carl. That was fantastic. And I love how you give us a lot of information, but you don't, it's not overwhelming with all the nitty gritty. So I appreciate you giving us a really good snapshot of everything that you guys have. And Carl was nice enough to let us record this today. So I will be emailing everybody out a copy of the webinar with a little link if you want to share it with any of your team members or watch it again. And if you guys have any questions, none rolled in as he was presenting, but if anything pops into your head after the fact, feel free to shoot me an email, just reply to the webinar recap, and I'll be sure to reach out to Carl if I don't know the answer and make sure to get all your questions answered for you. I think that's all we've got. Thank you so much, Carl. That was fantastic.
Appreciate you having me. Look forward to seeing some of you in person. I'm working with Matt. For those of you who come into the office, I believe I'm coming sometime in April to do some exciting new updates on the under 65 market as well. But I appreciate each of you. Thanks for carving out time for me today. And like I said, we're here to help you. So don't be a stranger.
Absolutely. Until next time, you guys all have a great day. Thanks.